Okay, here we have a tooth representing a gum focis. Remember, is a peg joint. And the tooth, of course, is sitting in this alveolar process, in this very airy cancellous bone inside the skull. Let's take a look at some regions of the tooth first. This upper region, say up above my probe here, is the crown. The neck is this region here by the gum line, and then of course we have the root of the tooth. The crown of the tooth consists of enamel, and so it's the enamel that's exposed. It's a very, very hard substance, hardest substance in our body. And then below the enamel we have sort of a bone-like structure of the tooth, which we call dentin. So this is the dentin here actually in number 20. This is 19 is the enamel, 20 would be the dentin. The dentin has tiny little canals within it, which are called dentinal tubules. And basically, they communicate what's going on in the external environment with the internal environment when they are exposed. Thankfully, most of the time, the enamel is covering them, or the gum line is covering them. But when we have a receding gum line, or when we have dental caries, which are cavities, the dental tubules can communicate directly with the nerves inside the pulp cavity of the tooth. It's the pulp cavity here. And of course that's when we experience pain. Notice that the pulp cavity then is the region where we have blood vessels as well as nerves. And these blood vessels and nerves travel through the root canal to the pulp cavity. Holding the tooth in place is the periodontal ligament, which connects directly to the bone itself, as well as to a hard connective tissue that covers the surface of the tooth. I think it's probably represented best here, which is called cementum. So basically, periodontal ligament attaches to the tooth at the cementum, and then it attaches directly to the bone. Okay, let's take a look here. These are, of course, the actual teeth. These are the incisors and the canines right here. And then we have the premolars and the molars. Now, the premolars, of course, are the teeth that we have as children. They are the molars that we have as children. They continue to function as molars, obviously, in our adult lives. But as we age, we wind up picking up more and more molars. And of course, when we're probably in our late teens, we wind up picking up the wisdom teeth, the last of the molars here.